Hello, welcome to our channel. So today I'm going to talk about some common myths about OET speaking. So during the preparation of the OET, many students they undergo some doubts regarding the preparation, regarding the format, regarding how to attempt the question and what is correct and what is not. So today we'll discuss about some common myths with respect to OET speaking. So you need to understand about OET, how the test will be and what you really need to do to get a good score on your OET test. So the first common myth is it is important to impress the interviewer or the interlocutor during your OET speaking subtest. So, to be honest, it will really be good if you do that. You can do this only by being good at your English, that is your communicating skill. Your extraordinary dressing sense, your remarkable style, and your sweet or charming behavior will be the secondary thing. But the most important, your extraordinary dressing sense, your remarkable style, and your sweet or charming behavior will be the secondary thing. The first thing you need to take care is about your English language. You should very comfortably communicate with your examiner, with your interviewer, and also fulfill all your tasks. But it is good to look more professional when you attend the interview. You need to act, behave, and talk more professionally. You really do not have to crack jokes. You don't need to be very much friendly to impress the interviewer. You do not have to show an attitude that is really not yours. So do not act. Please be natural. Many people think that different OET test centers may have different levels of leniency in the test. So whether you take OET from your own city, own country, or from another city or another country, or it is a less developed area or it's a metropolitan city, it's going to be just same. There will be no change in the test format, test structure, difficulty of the test, and assessment criteria. You'll get a score you really deserve. All the OET interviewers are trained and they'll ask you questions that could help with assessing your English language. You'll have the choice to pick any test center which is nearer to you. No malpractices will be allowed. All the test centers across the globe follow the standard rules and regulations. Your accent is important as it is one of the OET test scoring criteria. Yes, it is necessary that you should have a proper accent. You need to make use of correct English. Pronunciation should be good. Speak in your own natural accent. It is not essential that you should have a British, American, or Australian accent, but if you can speak in your own accent with no mother tongue influence, then it is all simple for you to get through the test. Your accent is important in the OET test. Next thing, you're not expected to ask questions. This is wrong. You can ask questions if you do not understand anything. You can ask questions as per rules of your role play. Do not step back from asking the questions. In fact, in most of the role plays, it is expected that the nurses should ask as many questions as they can to get the required information about the patient or patient's illness or other problems. So please do not hesitate to ask any questions. If you want, if nothing is clear to you or any doubt is there, you can ask the question to your interviewer. Next thing, making use of medical vocabulary or high-sounding words is very important. Well, here I would say it is not important that you should make use of advanced medical vocabulary terms or phrases. In fact, you can make use of simple vocabulary because here you might be talking to layman, like it can be a patient and it can be patient's relative, because the person to whom you are talking is not medical professional. So you should be very simple when you are telling anything to the patient. That will be enough, as in most of the cases. You'll be playing your role as a nurse or a doctor or a physiotherapist. Many more professions are there. So interviewer will be playing the role of your client or the patient. So it is necessary that you should try to make use of English that is understandable for the patient or client. So these were the common myths that students think are there regarding the OET speaking. According to me, nurses play a bigger role when it comes to patients' healthcare. And if you want to get success in OET, your speaking depends largely on how effectively the nurse assesses the patient's concern or the needs. So, the nurse will have to be capable enough to identify the preferences of the patients and be ready to learn and support the patient anytime he wants. So, how to start it? The first step is to find out what the patient may require. Your OET card will provide some basic details about what your role should be, what type of problems the patient has, what information you may possibly have to collect from the patient, and many more things. There will be some pointers for you, and you will have to be intelligent enough to collect the information which can help you to get to know the patient well. Remember, you'll have to talk to the patient and gather information. You do not have to just sit and make assumptions observing the patient, or you'll not wait for the patient to ask you something. So, by asking the right set of questions, you can get to the root of the problem, and then you'll be able to provide better suggestions and recommendations. It is very important to establish a rapport. You'll have to focus on building rapport with the patient. Most of the nurses do not pay attention to this. They just start the conversation, they begin asking questions and try to get the answers they need. This can be considered a cold way. Your examiner may not expect this from you. You'll have to be friendlier to the patient. You'll have to be good at building the relationship with the patient and provide personalized care and support. The way you talk, the way you behave will also be taken into consideration. So, be careful, make eye contact with the patient, make the patient feel more comfortable, pay attention to what the patient is saying, and show personalized concerns. Show that you are there to support the patient. You'll have to be good at gaining the trust of the patient. Now, next important thing is be good at identifying the patient's perspective. In order to get a good score in the OET, you'll have to be good at identifying the patient's perspectives too. Talk to patients about problems, fears, possible misconceptions, worries, and many more things. The vital information can help you chart out a better approach to deal with the patient.